Hello viewers, welcome to NRG Healthcare. I am Dr. Akila. Today we will discuss further about pneumonia. During the last episode, we discussed what is pneumonia and what are the symptoms of pneumonia. In this episode, we will discuss what are the types of pneumonia and what kind of test we do for pneumonia and treatment available for pneumonia. Before entering the video, if you have not visited NRG Healthcare, please visit NRG Healthcare, subscribe and press the bell icon also. There are a lot of health related information from health professional to general public is available. So when we come to types of pneumonia, common pneumonia is when we are in the community, at home, at workplace, in the air, we get the bacteria, fungus or virus into our lungs that causes lung infection. This is called community acquired pneumonia. The second type of pneumonia is when the patient is in the hospital for some time and then they have pneumonia due to different infection. So this is called community acquired pneumonia, and some patients when they are in ventilator they can develop pneumonia also, ventilator associated pneumonia. Similarly, workplace can be a trigger. For example, dye industry, steel industry, where the chemicals that can affect the lungs that can cause pneumonia. This is called chemical pneumonia. The last one is called aspiration pneumonia. Normally what happens is when we eat, the food goes to food pipe and stomach. But when we are not conscious or the reduced conscious level, the food from the mouth can end up with breathing tube and into the lungs. Or if they are vomiting, that can enter into the lungs. This is called aspiration pneumonia, quite common in patients who are under the influence of alcohol or stroke patients where the conscious level is less. So these are the common type of pneumonia. Coming to the test done for pneumonia, initially we arrange a blood test which will show whether there is any infection is there or not. And common test asked is chest X-ray. The chest X-ray will show whether it is a normal looking lungs or any infection in the lungs or any fluid collection in the lungs. And in pneumonia, we have cough with phlegm. So we can send that phlegm for any bacteria infection screening or virus infection screening, fungus infection screening. If the patient is sick or we are not getting any clue about the infection, we advise CT scan of the chest. And also if there is any fluid collection in the lungs, we can take that fluid and send for test to know what kind of problem is causing pneumonia. So these are the common tests. If we don't get any clue and patient is still not improving, then we ask for a test called bronchoscopy, which is the endoscopy test into the lungs, and they collect the fluid from the lungs, we send it for the testing. Coming to the treatment. The treatment is mainly to prevention of infection spreading to others and treating the patient. Like coronavirus fever, any pneumonia can spread through air. So the patient relatives or attenders needs to be careful about spread. So we advise hand washing, wearing mask while looking after the patients with pneumonia. The severity of the infection decides the treatment. If the patient is well, then we give antibiotic and we can treat the patient as outpatient. If they are having breathing difficulty, if they are not able to eat, if they are getting tired, oxygen level is not good, then we have to admit the patients and give the antibiotic through the vein. And also we need to give oxygen, nebulizer if the wheezing is there or chest is too tight to breathe. And if the infection is so severe, it can cause infection to the other organs, and also sometimes patient end up with ventilatory support also. So depends on the symptoms, we monitor these patients and look for any complications of pneumonia. Sometimes it can cause severe infection where the blood pressure can go low and oxygen levels can go low. That time only we put the patient on ventilator and need to give medications to improve the BP. So these are the common treatment given for pneumonia. but best thing is prevention. So there are vaccination available to prevent some of the pneumonia. It is better to have that one. And also general immunity needs to be improved by having proper diet and regular exercise, and avoid smoking also. So we have released videos on different topics like this. So please see, be aware of these symptoms and inform your friends also. Thank you for watching.